Okay, thank you everyone. Sorry for waiting, and a beautiful afternoon to everyone on the call. So welcome to our RS Academy March 2023, where we'll be looking at an enticing and inciting topic. The topic is partnering with health insurers, that is HMO, to boost sales for pharmacy business. Here we have a professionals, highly skilled professional in this field that will be walking us through this topic this afternoon, in person of Oluwaseun Thompson. So without wasting much of our time, I'll be your host for today's webinar series. My name is Olatunji Rashid. I'm the B2C team lead for RX All International, and our speakers for today's topic is Oluwaseun Thompson. So without wasting much of our time again, I will quickly hand it over to our professional to actually do justice to this wonderful topic. So I just want to implore us to pay maximum attention to this topic, and we would have a discussion at the end of this presentation. So during the course of the presentations, while the speaker is actually giving this, if you have anything to note, you can actually drop it in the chat section. So at the end of the lecture, we would take questions and any comments from any of our attendees online. So just drop any questions, observations, and comments to the chat box during the course of the presentation. So Mr. Sheil, a beautiful afternoon to you, and over to you.
All right. Thank you, Mr. Rashid, and good afternoon, everyone. Thank you for joining on this call today.
Good afternoon.
All right, so without wasting our time, let's just go straight to the business of the day. So our topic for today is partnering with health insurers, that's HMOs, to boost sales for pharmacy business. So I'm going to walk us through some of the processes and how you can actually grow your revenue and actually also get to scale your business as a pharmacy. All right. So at RXO, our mission statement is to make quality healthcare accessible to everyone. Why this mission inspires us to have RX HMO as a product. We can help more people have access to high quality drugs through their health insurance. All right, so for the next slide, this is just a brief introduction of the product. All right, so at RXO, we have the RX HMO unit. RX HMO unit is the RXO B2C product that provides exceptional service to HMO organizations in their pharmacy benefit model, and also allows their enrollees across the 36 states and the FCT have access to high quality medicines across the country. Now, this is possible through our diverse HMO partners with over 5 million enrollees in each of their database in Nigeria and also outside the country. Now, for the HMO industry is a growing industry. That's the health insurance industry. And I think there are over 30 plus HMOs in the country and also still adding more. And we have been privileged to onboard a couple of them and will service them day in, day out. So I'm going to expatiate more on that process just after this slide. Now, this is just a glance of HMOs that we'll partner with at the moment. We have Leadway on our network. We have Clearly HMO on our network. We have health partners on our network. We also have United Healthcare International. We have IGI HMO. We have Mark HMO. We have Metro Health. And we have Fountain Healthcare Limited. And we are still adding more to these numbers. So you can be sure that before the end of Q2, these numbers will have scaled up much more. And that means that we have so much on our list to provide care to using our pharmacy network. So this is just the benefit of you partner with RX HMO. Now, if you decide to be a member or an RX Go partner or an RX HMO partner, as the case may be, one of the benefits you stand to gain is that as at RX HMO, and as we call you RX Go Pharmacy, that's the name we use. So you might be saying RX Go Pharmacy. Once you're on board, then we refer to you as RX Go Pharmacy. We still use your pharmacy name nevertheless, just to make our clients know that, okay, we have a drug pickup center at a particular location or no. So at RX HMO, RX Go Pharmacy partners grow their sales by 50%. So if you decide to partner with us, we have the pool of enrollees from the HMOs. And when we start giving you business, you can be sure to know that your business can scale over a 50% revenue over time. Now, the second benefit you also stand to get is at RxHMO, we also give you more brand awareness, which means that when all these HMOs that we have request to know that which pharmacy do you have in this location, automatically we can tell them their risk can visit so and so pharmacy, and they can pick up their drugs from those pharmacies. Now, this also means that some of those only can walk in and decide to also buy out of pocket, which might necessarily not mean that the HMO is paying for that. So that one counts for you straight up. And they can also talk about you, maybe talk about your exceptional service to their colleagues at work, or maybe they walk in and they see some of the drugs you display on your shelf, or some biomedical drugs or non-essential drugs, and they can also help you advertise those things. So it gives you brand awareness when you decide to partner with us. The third benefit you also stand to gain is that it increases foot traffic to you, to your pharmacy. Now, more foot traffic means more money. Obviously, not everybody will buy when you talk about foot traffic, but the more the foot traffic you have, it inevitably means that your sales must increase. So that is one of the benefits you start to get when you partner with RxHMO. All right, so then the last one here is that RxHMO also helps with your business growth, which can help you scale fast. So this also works with point number one. But the difference here is that the point number one has there's a database, there's a data to that. Why for this, your business can scale over time, which means that imagine when you partner with us, we give you a business worth 100,000 in your first month. You can be sure that if your services are exceptional, you will give us all the qualities which I'm going to mention going forward in this presentation. We'll give you more requests and we'll give you more revenue, and that scales your business fast. So it means that you might probably have to bring in more staffs, you might probably have to get in more drugs, and at the end of the day, that's more profit to your organization. The next slide. All right, so this is at a glance how to sign up. Now, you might have that question, how do I sign up? I'm getting interested now. I like the fact that I want to scale my business. I like the fact that I can make more money from RxHMO business. So how do I sign up? Now, these are the things you have to consider before you sign up. The first thing is that we ask you, we need to know how wide your range of SKUs are, how wide your range of medications are. For us, we cover the chronic medications, we also cover the acute medications too. And you know, chronic medication is excessive, so you need to know how wide it is. You also need to also probably when you start getting a request from us, you have an idea of the kind of drugs we request for, and you can stock more. We also deal with generics products, and in some cases we can tell you that we need branded medication. So as the case may be. The second thing, which is the most important thing here, is the competitive pricing. Now, your pricing will dictate the kind of request you get from us. Give us something that is very competitive as far as giving us some percentage. We have pharmacies across the country that has willingly given us a 10 to 15% discount off any medications we buy from them, except for maybe supermarket items or for some items that are not drugs. So you can also decide to do that. If you give us that, be sure that you get as much as possible requests from us over time. The third thing is, which is also very important, is this third point, quick and responsive pharmacy process. Now, there are so many ways of contacting you. We always decide to have a WhatsApp chat, a WhatsApp group as the case may be. Now, this WhatsApp group makes the process very seamless. One of our representatives will always drop, when there's a request for your location, they will drop that request into that group straight up. And we expect that at least your turnaround time to respond to us must not be, even though we know you're always busy, but your turnaround time should not exceed 30 minutes at the most after you must have dropped that request. If you don't respond to us after 20, 30 minutes, we might probably have to call you just to let you know we've dropped the request for you. And if you still are still not responding, we might probably have to move that request to the nearest pharmacy. Because one of the things we push to these HMOs is our turnaround time. So another thing we also tell the pharmacy partners who are also willing to partner with us, the turnaround time has to be very fast. And either you have a dedicated WhatsApp chat and you have someone managing that, not just for us, just also for your own in-house process or for your pharmacy business too. The next one is delivery system. Now, a couple of the HMOs we have do the delivery system. Some do pick up. Now, for the ones that pick up, when we get to the operations flow, I will explain how that works for you. Now, for delivery system, we always want to have pharmacies that probably have delivery guys. Maybe you have a dispatch rider, or you can actually outsource that. Just let us know what the cost is. And most time, we like to have the cost not at the average of something that is going to be too ambiguous for us. So just for the benefit here, we have different costs for different locations. I know Lagos is always expensive, but then there's still a cap or there's a flat rate that we can't do above in Lagos. So if you are a pharmacy partner who is in Lagos, we can always let you know that there's a cap to what we can do as delivery. But when you partner with us, we can always take that discussion forward. Now, the next one is prompt response to queries. So there will always be queries. Queries can range from maybe dispensing, you don't have a particular brand. Can you go ahead with this brand? You know, you have to have a pharmacist or a farm tech person who is very agile and can give us this prompt and say, okay, yeah, RX Solo, there is no brand for this. Can we dispense such brand? When you give us those queries, we escalate back to the HMO, and when we get the go ahead, we let you know. So we expect that when you're partnering with us, be as fast as possible when it comes to escalations of queries. Now, everything at the back of your mind is how do I sign up? You can see the code, the sign up address real time. Mr. Rashid, please let me just type this in the chat box for everybody to see so they can copy it and do that while we're also having this conversation. So maybe after the call, if you have questions on that, we can take that. So if you have to sign up as an RS Go Pharmacy network, just sign up as a buyer retailer on this. You can see every time www.rxalldelivered.com. They are all together. So once you sign up, it is going to ask you some questions. Just provide all the required information. You get an OTP which has to be entered immediately. Once you do that, you get a text message, welcome you to the RX or the RX delivered platform. Now the final one is the complete provider application. So this is what I've explained real time. After you've detailed all your information on the RX delivered platform, you get an OTP that also allows you to proceed to the next stage. Now that OTP is real time. I think it expires after either 60 seconds or 50 seconds. So it has to be real time. So once that is done, you get a text message immediately welcome you to RX delivered platform. All right, so this is the interesting side of it. Now you've signed up. How do you process your order as a provider? Now, the first thing is that on the left side, you'll see the acronym RX HMO receives enrollee orders from HMO partners. We already have our process flow from the HMOs. Some of our process flow is either WhatsApp, some of them are either on via emails, but most times they are via email. So once they send a request, we'll copy those requests and send it to looking at the location. If it's a Lagos location, there are so many places in Lagos. Lagos alone has over 50 LCDs. So once we get the request and we get a location in Lagos, for example, we look at the closest pharmacy that can actually cover that route. We'll take that request and post it to your WhatsApp, or we'll send it to you privately on WhatsApp. And you are expected to give us the best price for that drug based on the turnaround time I've given you and the queries and all. So once that is done, we go to the next stage, which is the right side of this on my screen. Now we've sent the product to you already. The pharmacy partner receives the order. You get the order. This is where I am. If you can see my mouse, I'm on this place. The pharmacy partner receives the order. Then you confirm if you have that product or not. So if you have a product, then you go ahead to give us the prices. When you quote the price and we are fine with the price, based on how much we also agree with these HMO partners too, because it's a win-win for both of us. You are making profits. We also have to be profitable too. Now, after we've agreed prices, if it's a delivery, you give us how much it's going to cost to deliver to that location. If it's fine with us, we'll tell you to pack it ready. Now, the second point here is that on the approval of the prices of the price, they will ask you to either deliver to the client or we tell you that this is a pickup. The HMO only walks into your pharmacy to pick up this medication. Now, going to the top of the screen, can you see that? You can see that. I'm sure you can see that. Now, this is where my mouse is at the moment. This is how, now, after the enrollees must have received their medication, that's you've delivered the medication or they've picked up. Now, you're not expected to let us know. You confirm that they have delivered it. That your dispatch rider has delivered. If it's a pickup, you confirm to us after the process flow that this has been picked up. Now, after you have done that, you send us an invoice or a receipt. Please don't forget, you have to send a receipt showing the name of the enrollee and the name of the HMO, which every time we provide that information to you. So when we are sending you a request, we provide you three things. We provide you the name of the HMO, we provide you the name of the enrollee, and we also give the ID number of the enrollee. So you might not put the ID number on the receipt of the invoice, but it's the name of the enrollee and the name of the HMO. This helps our own sorting when we want to pay you. Now, after you've sent us the receipt, Now we initiate payment. Now our payment process takes between 72 hours or less. It takes between 72 hours or less. It does not go more than 72 hours. It might be at times, for it's just in rare occasion, it might be, but it takes between 72 hours or less. Most times it might be 24 hours, at times it might be 48, but it does not go more than 72 hours. All right, so let me go to the next slide. Can anyone hear me? Are you guys following me? If you can hear me, say I can hear you.
Yes, I can hear you. We can hear you.
All right, perfect. Thank you very much. All right, so this is the last slide. This slide explains the. Sorry, I'm trying to go back. All right, this slide already explains the process flow. We send we send you the request. You give us the prices, just a summary I explained there. We send you the request. You give us the price for those drugs. The ones you don't have, you let us know. The ones that you can probably use as substitute for those ones that you don't have, you give us the feedback. We get back to the HMO. If they give us the guide to supply, we tell you, please pack and supply. If it's a pickup, we tell you the HMO enrollee is coming to pick up. Now, for the ones that they tell us not to go ahead, we tell you if you want to wait for this drug or this medication to be delivered or for you to have this drug in your pharmacy, how many days is it going to take us? You give us that feedback, then we tell the HMO, please, so drug is not available in XYZ pharmacy, but it's not available so and so date. Now, if it's fine by the HMO, they tell us go ahead to source. They will come back to you and tell you, please go ahead and source. So once you have that medication in your pharmacy, you immediately get back to us so that we can tell the enrollees to come and pick up or you can deliver to them. Now, after you have delivered, just a summary of what I explained here, because this seems to be the second to the last slide. The enrollee has received the medication or the picked up medication. You're expected to send us an invoice. Now, I mentioned that on that invoice, you must have the enrollee name, either leadway, clear line, whatever the information, we will have sent you that information on the WhatsApp. Then you also give us that on the invoice or the receipt. Then you also give us the ID number of enrollee, which we will also have sent you to on the chat. And the third one, which is also very important, is that you give us the name of the enrollee. You must show that on the receipt. Now, after you send that to us on the WhatsApp chat, I mentioned earlier that our process timeline takes at the most 72 hours. But most times it does not go more than that. But even if it's going to exceed 72 hours, we'll have told you, and it does not happen except we have a downtime with payments, which we'll have told you earlier. So we'd like to tell our pharmacy partners this so that they can have an idea before we go into full partnership. All right, and then once you have sent us the invoice, we'll initiate payment process. So on your payment process, you get a mail after you've registered. On that mail, you use the registration that this also and so product have been processed, just to keep track of it. You get a mail, you see a breakdown of how much your money is going to be and which enrollee was approved. Every time we approve everything. So far, you give us a right invoice, we approve everything. If we don't approve everything, there will always be a reason for it, and we will always get back to let you know. Then after a while, I also send you a confirmation. Anyone on the team sends you a confirmation of your receipt, that's of your payment receipt. That's which you get that before the payment drops in most places. So it gives you an idea of how much is being expected. Then once you see that and the payment drops, then you get back to us and tell us that you've received your payments just to acknowledge it. So that's a summary of this. Like the question and answer. For more information and inquiry, you can contact. This is the mail you can reach out to, rxhmo@rxall.net. Please send us every information you want, anything you want to ask about. And maybe there are some things, there are some thoughts that are not clear to you or whatever, you can always reach out to us. And these are our phone numbers, 07062943506. You can also put a call through to us to get more clarifications and maybe you need to get to how to onboard properly. We're always available to do that. Or you can also call 090-1051-5756. So this is the end of the presentation. I'm going to take your questions, your clarification, and your feedback. Thank you very much, everyone, for listening.
Wow. What a short and insightful presentation. Thank you so much to our speaker in person of Mr. Oluwaseun Thompson, the key account manager for HMO business for RxAll International. Thank you for that wonderful presentations once again. In fact, I was just like, wow, I can just have a business and someone will be somewhere there to actually bring clients to me and sell and assist me to grow my revenue. Wow, what's a kind of easy business to actually do for anybody that's actually see this as an opportunity to actually grow their business. So this is actually a kind of opportunity to our merchants that we have in-house. So we can actually really help you to grow your business at the comfort of your pharmacy. Wow, this is quite interesting. Okay, I have questions, but would like to take questions from our chat box that our attendees have actually asked. I'll be taking it from the first one. Okay, someone asked a question that's Sterling Diza. You say, what are the other benefits for pharmacy sign up under this platform? Do we get access to other services aside from the benefits you actually mentioned? Can you take the yes? Yes. Yes, even I personally can actually answer that. There are other benefits you can actually get, Mr. Sterling Diza. So one of the benefits is when you actually sign up as one of the pharmacy partners, you can have access to financing also. So RSP financing, whereby you use this finance to actually support your business. That's actually one of the things. So I think I will still leave the speakers to give us other benefits aside from this he has actually mentioned. Mr. Sheo.
All right, thank you, Mr. Rashid. So to the person who asked the question, I can't see the question because of this screen, but nevertheless, Mr. Rashid had mentioned the question. So we have so many other arrays of products. We can give you the funding parts, that's the RX Pay, we have the RX Scanner, we have so many products. But to make you understand better, you might probably need to reach out after this call, so we can give you a catalog that explains other products that we have, or after onboarding you on the RX HMO, we'll give you more information. As we give you more business, you can always get to see which other things you can actually benefit from us. But it's not limited to just the RX HMO model alone. There are so many other products that you can actually benefit from RX. So these are our numbers on the chat on the screen. You can see them. So you can reach out privately. You send us a mail to onboard you properly, or you're on board and you can call, and so that you can take it off from there. Thank you very much.
Okay, in addition to as answers to the question, the first one I actually mentioned as part of the benefit is RSP. We can actually finance your invoice, whereby it will help you to have this wide range of SKUs. Wide range of SKUs based on the way the speaker actually presented it, that before you can actually be onboarded, you need to have a wide range of SKUs. And if you are having this financial challenges to actually stock your pharmacy, I think we can actually, coming under this partnership, we can actually give you an RSP whereby we finance you. It will help you to actually have a wide range of SKUs. Then if you are also in the location whereby people are actually sensitive or about what they actually take, we have also a product that can actually really solve this for you. That is RX Scanner. RX Scanner can actually help us to actually detect if a particular drug is actually authentic. So that's one of the benefits you tend to actually get when you come under our pharmacy benefits. I think that's actually covers that answers, Mr. Sterling Diza. But if you still have any other comment to that, you can still drop to that chat box. Then we'll go to the next questions. Mr. Oladejo here asks, if I come up as a partner, is there any other benefit aside from the one mentioned? I think we've actually answered and cleared this also, Mr. Oladejo. Then the other one, Mr. Dari asked this question: who is going to be responsible for drug retrieval when an enrollee rejects the medication, maybe due to the brand? Can I take the question again? Who is going to be responsible for drug retrieval when an enrollee rejects medication, maybe due to wrong brand? Mr.
All right, so let me answer. Thank you very much, Ms. Rash. So this happens in rare occasions, actually. In rare occasions, it does not happen. But should in case this happen, we tell the HMOs most time that we don't collect drugs back after they have left the family. But for some occasions, the HMO was one that actually made the mistake. They sent a wrong strength of a drug. Let's say amlodipine valsartan, the client needs 5 mg. But the information the HMO had at the moment is when it sent the request to us was amlodipine valsartan 10 mg of 160. The HMO has already, the pharmacy has sent 5 mg of 160. Now the HMO has said, please, That's after maybe between a time frame and say, please help us retrieve this drug back and deliver this one. So far, it's not a cold chain. Cold chain will tell you we can't retrieve, but if it's not a cold chain, you have to talk to the pharmacy first. Them, please, this is where the issue is. If the HMO has actually made a mistake, the wrong prescription, it's not your fault, it's not our fault. You're willing to help us bend and retrieve that drug back and supply the right one. So the pharmacy gives us awards. Most times, it's always yes. Why is not cold chain? I say no problem. Since we are business partners and it's not a cold chain, the drug is still in good condition. And so far, it has not gone more than 24 hours. If it has gone more than 24 hours, we won't tell the HMO that we can't retrieve back. So I don't know. Does that answer your question, Mr. Dari?
No, the attendee, we have to drop that comment on this in the chat box to know if they're actually satisfied with the question. If they need any clarification, we'll still drop it in that chat box. I think you've. So let's take it to the next question. Do we have one Felicia's raising the hand? Please, I will appreciate if you can drop your questions or comments in the chat box, Felicia. So the next question here is from Mr. Sterling. He said, can enrollee walk in to order drug directly using RS HMO? Let me take the question again. Can enrollee walk in to order drug directly using HMO? That's a question from Mr.
That question is not clear. Can enrollee walk in to order drug?
Yes, what this attendee is actually asking is, can any enrollee just walk into any pharmacy that is under our partnership to just go into the pharmacy and order drugs on their own? So that's the question.
No, that's actually not possible because the enrollees don't even know your pharmacy. We are the ones that send their address to the HMO or to the enrollee person and say, please visit our XYZ pharmacy. Either your drug has been packaged. Do you understand? Most times it's always a pickup. That's if the enrollee needs to visit, they are coming to come and pick up a drug, which will have told you before they come. So before they visit you, that drug has been packed ready first before they get in there. So enrollees don't visit any pharmacy anyhow. We don't do that. Most times we are the ones, we are the channel of communication between the enrollee and the pharmacy and between the HMO and the pharmacy. So when we have a request and there's a pickup, the HMO will say confirm the pharmacy location is so location. So we look at the nearest pharmacy based on what they've requested. So we look at the pharmacy and send that request to that pharmacy, looking at the location, and tell you that this drug will amlodipine valsartan so and so. XYZ, Mr. Wale Musa is coming from Lidu HMO. Pick up these drugs by so day. Please tell your pharmacist to pack the drugs ready. When they come, just ask them for their ID card, just showing the name. And it must tally with what we've sent you. So once that is done, just to make sure that we do due diligence on that, you give them the medication. Well, they can't just walk into any pharmacy and say they want drugs. No, you are always channel of communication between the pharmacy, the enrollee, and also between the pharmacy and the HMO. Thank you very much.
Thank you, Mr. Shio. I think in addition to that, most enrollees also have a budget, and they have the line at which they can actually get. So it's not just all drugs they can actually get, and they have an amount they can actually spend in a month. So that's also, we don't give them that chance to answer that, to order drugs on their own. Then the other question is, we have another question here on this. This is Mr. Diza also is asking the question: who pays delivery? Or you have delivery partners you assigned to pharmacy in each city? Mr. Shion, can I take the question again?
All right, thank you very much.
Okay.
Okay, thank you very much, Mr. Rashid, and thank you for the question. So for the delivery, most times, about all times, all the pharmacies we have always have a delivery plan. We have a delivery plan. So we pay for the delivery. You had that delivery fee into your fee, into the invoice. So we've sent you 3 drugs, amlodipine, we sent you lisinopril, we also sent you that, and you're supposed to deliver. You now tell us how much it's going to cost to deliver to that location. So you give us the price for the 3 drugs, and you also give us the cost for the delivery. So when we are tell you go ahead, and you are sending us the invoice or the receipt, the details of the delivery is going to be included underneath the drug. So you've given us the price for the drugs. You also put your delivery to Amuod of 700, delivery to London 500, and you now put your total on your invoice. So we pay the total together with the delivery. Thank you very much.
Okay, thank you so much, Mr. Shem, for that answer. So another question here by Felicia. She's asking a question: are you referring to wholesalers or retailers? Both cannot compete fairly as per competitive pricing. I think this is actually a good question, just like other questions other people have been asking.
Well, so we most times like to do business with wholesalers. In fact, it pays us to have wholesalers on this business model. Well, looking at the profit maximization and all. But we know that not all pharmacies do wholesale. Some do retail. So whether you are wholesale, whether you are retail, the most important thing is that whether you are wholesale or you're retail, make sure you give us a quantitative pricing. If you are retail and your prices are not fair, we will not do business with you. We will let you know. Maybe we'll probably have given you one or two, and we'll tell you, please, these prices are too outrageous, because we know what the standard of price are. For now, we know how much amlodipine costs in Port Harcourt. We know how much it costs in Ibadan. So if I have a pharmacy in Port Harcourt and I give you a request for amlodipine, and whether wholesale or retail, and your prices are enormous, that might be the first and last delivery request that we ever give to you. So whether you are retail or you are wholesale, we are always happy to onboard you and do business. I think that answers that question.
Okay. Thank you so much. I think if even for a retailer who knows that they don't even have that better markup, they have huge markup on their products. If they think of maybe the turnovers that they can actually begin, they can actually maybe bring this thing markup down for the sake of this partnership and the number of enrollees orders you'll be getting. At least you can actually look at your pricing. Oh, okay, thank you so much. So there's also another question. Okay, I think it's just like a kind of clarity for Mr. Sterling. He said, okay, I think it's just a follow-up to can enrollee walk into the other, just the question you answer, where he was now asking, what of in case of repeat enrollee? If I pick product this month, can I just go again next month without contacting my HMO?
Well, that is straight, is no. But the fact that an enrollee, in fact, another thing is that enrollees always refer pharmacists to us and tell us that, please, I have Sterling Pharmacy, which I like their services. Once they refer to us, we onboard that Sterling Pharmacy and tell them our terms and conditions. Once we onboard them. But an enrollee cannot just walk into a pharmacy and go and pick up drugs, except that the HMO has sent a request for that enrollee. So the first process first, a request must come every month for the enrollee. Let's say for Mr. Wali Babalakin, he or she picks lisinopril and Zalatan every month, every first week of the month. He knows that he picks from Sterling Pharmacy. He cannot go to Sterling Pharmacy next month after he has picked this month. There must be a mail that has been sent to us. So when they send a mail from the HMO, we now tell Sterling and say, please call these your clients or call this friend to come and pick up their drugs. We've sent a mail. So the pharmacy can call, or we can also call them and say, please go to your pharmacy and go and pick up their drugs. You can pick up your drugs as the case may be. Your HMO has sent us a request already. Do you understand? So, but they really cannot just come into the pharmacy without the HMO sending us the request first, as the case may be.
Okay, thank you so much, Mr. Sheon, for that answer. I don't know. I think we don't have any further question. Please, our attendees, if in case you have any question, you can just drop it to the chat box so that our today's speaker can actually attend to it. Just as a clarity also, based on the question Mr. Diza also had asked. Okay, based on it, so for if you come under the partnership, even if enrollee comes to this month to actually get product from you, it does not actually give that enrollee that gate pass to be coming every month to just collect that drugs from you without the normal process. So the standard process is before they can actually get, we must have actually communicated to you if you come under our partnership. So that is what Mr. Sheo is actually saying. So there is There is another question. Mr. Diza also clarified. He is also asking. Do you have separate tariff for retail and wholesales, or you use same tariff for both class of business? I don't think it's fair to use same tariff. So that's a kind of a comment on questions and comments from Mr. Diza Sterling. So I don't know. So can you help us share more light on this?
On the tariff issue, whether you're wholesale, whether you're retail, we know wholesales the markups are different. Why for retail your markup was so different? But like I mentioned earlier, we already have our standard for drugs. If I send you a request for which drug can I use? I've used amlodipine, I've used lisinopril. Let me say, if I send you a request for amlodipine in Nigeria, maybe the people who have the highest price of amlodipine in Nigeria are the people in Lagos, in Abuja, and in PH, based on our own what we've done so far over the months and over the. So there's a standard that is expected of those prices. If you are more than that, whether you are retail or you are wholesale, if the drugs are a smaller standard, then that's what we begin with. Do you understand? We don't tell you to set tariff. We most times don't want to do that, because at the end of the day, there's always a lot of back and front on that. We've tried that before in the past. So we'll send you as the cost price of those drugs are, give you a drug request, and give us our prices. We know the price might not be the same over time, but that's why we're giving you that leverage. When we have a request, we send it to just provide us the best price for generics, except otherwise stated for branded. So most times generic drugs are always very less drugs. But from some HMOs might tell you that, okay, give Galvosmet. But if it's a generic one and they say give Galvosmet, they send a request for Galvosmet. But some HMOs are using, and we claim the code, and the code they've given us to supply to the generally is the generic of Galvosmet. We tell you, please give generic Galvosmet. If they are giving us, if they have a request of Xforge, HCT, and what code they've given us is the Xforge itself. We tell you, give the brand of this drug, give us the price for this. So whether you're a wholesaler or you're a retailer, your price should they have a standard that it must always fall into based on your tariff. So if higher than that, then we begin to have some issues, and we tell you that the prices are expensive. I think that's the best way I can answer that question. But if you still do not understand, you might probably have to contact us after this call.
Okay, thank you so much. I think there is no competition in this for either wholesalers and retailers. Even retailer has a better advantage than wholesalers. The reason why I actually say we have more retailers than wholesalers. I know we wholesalers cannot cover everywhere, yes, but retailers closer to the people have more opportunity to actually get our drugs supply. So don't be scared about the dissing. But just ensure that within your hand, you have best and reasonable price when you actually come on board. Because don't let the pricing of the thing actually scare you out. Because I have another questions and comment also from Felicia, and at the same time from Sterling Diza about this markup. Okay, let me read out so that we can, if you have any other thing to also say about it, because now we actually want to onboard, everybody can actually benefit from this, because we actually have enrollees everywhere in Nigeria. You can say even people at the rural areas, we have enrollees at rural area. And if you're a pharmacy in the rural area, you stand out supporting to actually get those service all these enrollees in this way. So there's no competitions. Your region's location actually matters. So we can actually give enough share to everyone. So let's just have that at the back of our mind. But I would still like to read this Felicia's comment. She's saying that the markup difference is not the issue. Retailers will buy from the wholesalers. So how will they both be in the same market? Say not realistic. We understand all these things, just as I said. You know, wholesalers are not spread like the retailers. Retailers are actually more spread. So the retailers has more opportunity to actually get drugs delivered. Imagine if, for instance, a wholesaler is located in a particular place, and we have an enrollees who stays like maybe 20 kilometers away from that wholesalers. and we have other pharmacies who are actually closer to the enrollees, like maybe with 1 kilometers. Are we going to say the wholesaler should go and deliver about that 20 kilometers, whereby we now leave the retailers who is somehow closer to the enrollees? You know, it's not feasible for us getting those drugs fulfilled from wholesalers. So it will be the retailers, but just make your price competitive as much as you can. So I think that's what I can. I don't know if the speaker has anything to add to
Well,
this.
you said that. You said it, Mr. Rashid. Make your pricing as competitive as possible. That's just the summary of it. Whether you're a wholesaler or you're, in fact, let me give you a statistics or a data now. For this is our business, retailers get maybe up to 80% of the free up to 80% of our services for us. Because wholesalers are not spread all over the country. You know, so it's more like a retailer kind of a business. But in some cases where we need to use wholesalers of location, looking at that location where that request is going to, tell wholesalers please pack this in and they are. But retailers, they're the ones who are always very fast and they are swift to respond to our request and they take the business very fast for us. So, but if you have other questions and concerns, you can
Yes,
always.
I think the chat is actually burning at the moment. So I actually love input from Felicia and Diza at this this month's webinar series, because they make it more interactive with some of these insightful comments and questions. So I would like to actually take Felicia's this in. Felicia said, just deal with wholesalers. Widespread advantage is also okay. So for a retailer, they have that advantage because of the widespread and the allocation they have, because wholesalers are not everywhere. So that's that. Then Mr. Diza also said, and wholesalers are usually busy. Yes, very good. Yes, busy to attend to unit orders. Yes, I suggest you rethink your operations. It should be centered around with retail pharmacies. Mr. Diza, as I said, we have more retail even in our books at the moment than wholesale. We have just counting number of wholesalers. Yes, we partner with our retailers at the moment, a lot of retailers. So I just want to make that clear, because number one, just as you said, the wholesalers are always very busy. They can't be attending to a scanty number of orders, except for wholesalers who does not have maybe high business traffic at his or her locations. So I think that's so. I don't know if Mr. Shen has anything to this, and Mr. Diza, before we take some other comments.
Well, it's a very good point that Mr. Diza has made. But like I mentioned, we have more retailers on our network. And like I also mentioned, whether you are a retailer, whether you are a wholesaler, we are happy to onboard you. Do you understand? And like Felicia mentioned, it's good to focus on one ahead of one. Fine, yes, we also know that those are the risks in the business, which is something that we actually put in our yardsticks when we are onboarding. So, but then to summarize it, whether your pharmacy business is wholesale, we're happy to onboard you. Whether your pharmacy business is retail, RX is also happy to onboard you. Thank you very much.
Yes. Okay. I will still take this further comment from Felicia. She's saying competitiveness in drugs business is also not realistic. There are standard expense that you go with the business. If your price is lower, you won't survive. Yes. I don't know. Do you like to take that, Mr. Sheung? Or should I just maybe?
Yes, let me just.
Okay.
Yeah, I would like to say something. Yes, you know that that's the truth. The higher your markup, the more profit it is, right? While the lesser your markup, the less you are profitable in the business. And nobody wants to start a venture that is not profitable. But despite you wanting to have a high markup, also be careful of the buying power of people in that locality. You also have to be careful, because you don't just set price of drugs. You have to be careful of the standard that maybe that is what pharmacies in that location sell at. Because I know that each business has the location advantage too. So, well, it's something that we are also looking at. But Mr. Rashid can summarize that point.
Yes. Also, in addition, Felicia, I think as I said earlier, we have during the course of his presentation, he mentioned that we have that each of these HMO partners we currently partners with has over 5 million 5 million enrollees. Imagine we have 9 HMOs in our books, so that's about 45 million enrollees to actually service at the moment. So number one, the number is there. The traffic of the enrollees you'll be getting is actually high. So if you are even if you don't actually make your price that competitive, maybe if you are using maybe 35% markup before, for the sake of you become a partners and get more orders, you can just maybe reduce to 25%. If you are getting 25% and getting what's it called, enrollees product of 1 million or 2 million naira in a month supply, at least that can cover your business expenses that you actually mentioned. I think that will also be helpful because of the turnover you tend to get. At the moment, all the enrollees all the partners we currently have are having a lot of orders on daily basis that they would not even attend to on daily basis. So when you come on board, you tend to get even orders that you would not be able to, your staff capacity may not even be able to take. So that's something I can also guarantee. So that will also
to add to that. Sorry, okay, you can summarize. I wanted to add something to it.
So that will actually really help you to say, okay, let me bring this price because of the turnover I'll be getting from all these things, because you are in the comfort of your pharmacy and sales is just coming without any further stress. So that's what I have to say, Mr. Sheung. I don't know if you have any other input before we have another comment from Sam. So okay, let me hear you out. I think we want to wrap up with that.
Yes, so to add to that, thank you, Mr. Rashid. So we have a pharmacy, we have close to over 100 and still counting. And it will interest you to know on this call that some of our pharmacies million naira revenue from us, just from RX or every month. Some of our pharmacy partners, they have a couple of them because of their competitive pricing. So that's just what I intend to add. They do over 1 million naira from us every month. So imagine what 1 million naira or 2 million naira can add to your business, which increases over time too, as those requests comes in into. All right, thank you, Mr. Rashid.
Okay, yes, I remember. I think we have a other comment from Mr. Sami. Mr. Sami happens to be one of the beneficiaries, so he also enjoys the partnership at the moment. So this is a kind of testimony at the moment. So we actually, he actually enjoyed Mr. Diza and Mary and Felicia to actually join the network to actually enjoy what is actually benefiting. So he said there are many pharmacies already joining. I think he is testifying to that. So volume also help to make up for markup discounts, and the HMO extras orders also brings you in at zero cost. Can you see it? Acquisitions to the pharmacy, so profitable. So this is just a testimony from one of our beneficiaries, our partners already. So I think I will even appreciate if even more partners are also on the call who are actually benefiting at the moment from this number of release order we actually give to them, push to them. Imagine you are just the comfort of your shop, and at the other hand, you be getting a sales of 2 million in a month. That's a whole lot. So so I think that's okay. Thank you, Felicia, for this. So Felicia says yes, you have a point. I think most of those points has actually been clear to Felicia. So I hope other attendees on the call also enjoy this session. I don't know if anybody has further questions. Please, we appreciate if you can just drop your questions to this chat box. So I think before we get more questions, so what I would like to actually say is, coming under RSO merchants, RSO network, we actually help you holistically. What I actually mean is that one, RSO really wants to actually help all pharmacies to ensure that you actually scale up and grow your business and make it profitable, so that you can also grow and develop yourself. Look at this, from the B2B part, RXO try to provide financing for most struggling pharmacy so that they can have a wide range of SKUs. That's a part, that's a product on its own that really help you to actually sustain your business. And on the other part, they are still helping you to even sell your product. That's the other thing. You can see, it seems RXO is just providing an holistic help to the healthcare sector, even pharmacy to be precise. So this is something, this is an opportunity for everyone on the call to actually join RXO network, because when you join RXO network, it means you are actually able to grow your business in all way around. We provide financing to you, and we see help you to actually sell your products. Wow. This is an opportunity I must commend RXO for. And if in case we have other maybe colleagues, friends who actually missed this opportunity of this webinar, we would have this repeated section of this webinar so that you can still get some insightful comments we've actually addressed today about our HMO, how we can actually use that to actually boost our pharmacy and grow our sales in the pharmacy business. So we have our contact details here in case you actually want to come under this our RXO network. You can reach out to us at rshmo@rxo.net. I can also call the 2 lines that is there on the screen. I don't know if we don't have any further questions aside from the last one from Felicia. So I think Mr. Speaker, thank you so much for your time. We actually enjoyed this session. It's actually an insightful one. I've actually learned a lot. I've seen parts where I can also maybe using my own pharmacy also to come on under this your franchise, so that we can use that to also scale our business and so as to those people that actually attend these programs today. So thank you for your time. So before we actually end up this session, so I just want to put our minds that our next webinar section will be next month in June, and the topic we'll be discussing is keeping up with pharmaceutical care. So how to grow sales and retain client pharmaceutical care. So that is what we'll be discussing next month. So we enjoy to just watch out. We'll be sending that out before mid of next month, and also we would also share this recorded section of this month webinar on. It will be on our social media. That's RXO, Instagram, Facebook, LinkedIn, and Twitter. Also, you will all get that from Monday. So so we don't have any question. So we have also last question from C. Dikat Kamal. He said thank you. I think they actually enjoyed this section. So so without wasting much of our time, we've actually spent an hour already. So Mr. Sheon, thank you so much for your time. So we'll meet here again same time next month. Thank you so much and have a wonderful afternoon, everyone. Bye for now.
Yeah, thank you, Mr. Ashin. Have a nice day, everyone. Bye.